The main topic for the work we're doing at the moment is the mental health needs of young people living in out-of-home care. And out-of-home care is a term for young people living in foster care and kinship care and residential care under the child protection system, where they've been taken from their families because of abuse or neglect or some other form of maltreatment. And these young people have experienced trauma in their lives by and large and have a significant range of needs, often not only in terms of mental disorders but also in terms of emotional distress and the needs for a secure living environment. We're looking at the needs of the young people for support and care, and particularly the ways that we could work with their carers, either their foster carers or kinship carers, that's often their grandparents, or the residential care workers, to see how we could partner with them and the agencies they work for to provide a stable and living environment for these young people. We know that up to a third of the young people leaving care become homeless within 1 year, that around about the same proportion of young women become pregnant within that period, and that suicidal behaviour is very common in the years after leaving care. With this area of work, we're aiming to understand more clearly the mental health needs of the young people and the needs that the carers have to provide good support so that they can provide emotionally attuned care for these young people. It's really parenting under the most difficult circumstances. Young people who are distressed, who have not had experience of a stable family life, and who have been often moved from place to place. So if we can provide support to the carers, if we can create the partnerships between social services, government and non-government, and the mental health and health services, this is likely to provide a more sustainable way to do that. To make this work successful, there are two main requirements. The first one is the partnerships I've referred to already between health services, particularly mental health services, and the social service system. So the second area is to work with the young people themselves and to engage them in the research as well as in the change development work that we're undertaking and the partnership development. We can do that in part through working with existing support agencies for young people who have had experience of living in out-of-home care, and to provide particular training in the research and in the project work that we're doing. There isn't a lot of work in this area previously, and it's quite challenging. We're finding new challenges and obstacles as we go on week to week and month to month, but that's what makes the work worthwhile and rewarding for us.